Good afternoon, Mr. Chair and members of the committee. My name is Ocean McIntyre, and in 2008, I began rapidly losing my vision from a disorder called idiopathic intracranial hypertension. I eventually lost my independence, my ability to work, and ultimately my life as I knew it. But it wasn't just my condition that led me to lose my vision. It was also the countless delays to obtaining treatment that I encountered, thanks to prior authorizations. These delays kept me from receiving the treatment I needed, as my brain essentially crushed my optic nerves. I have to live the rest of my life with the effects of prior authorization. Had I been allowed to get the care that I needed, when I needed it, I would still be able to drive a car, fly a plane, look through a telescope, see colors, or walk without a cane. But I can't, and I never will be able to do those things again. My trials with prior authorization began as soon as I received my diagnosis. My doctor requested an urgent authorization to see a neuro-ophthalmologist, but it was denied. He put in another, and it was denied again, and again, and again. I spent so much time calling to find out why the authorizations weren't approved that I developed a new relationship with my medical group's nurse case manager, who is equally frustrated by the denials. I can't tell you how many times we sat on the phone together and cried. For more than 12 weeks, I did not get an approval for that urgent authorization. And during that time, there was nothing I could do. I couldn't pay out of pocket because of the rules that existed. I was stuck. By the time I finally got to see a neuro-ophthalmologist, I could barely see at all. I needed to have surgery as soon as possible to preserve what remaining vision I had left. It took 2 more weeks to get that authorization. Later that year, I finally had brain surgery, which took another fight. After that procedure, the neurosurgeon said he didn't think I'd ever be able to live a normal, independent life again. My recovery has been long. It was excruciating. But the hardest part was that my child, who was 7 at the time, had to experience it along with me. I became a shell of the person that I once was. We were homeless for over a year because I couldn't work. It took 10 years. But I was eventually able to get a full-time job again. It has not been easy. I know that I am not unique, and there are countless others who have gone through similar experiences and far worse because of prior authorization. Being repeatedly denied care made me feel like I wasn't important, that my life was not important, and no one should be left feeling helpless and hopeless as they lose their health, their quality of life, and even their very life itself. That's why I was thrilled to learn that this legislature could fix this broken system by passing Senator Skinner's Senate Bill 598. Health insurance should be there to provide you the care you need when you need it. I urge this committee to please vote yes on SB 598. Thank you.
Thank you.